Hello, everyone. This is Dr. Viet Lee from the Academy of Online Radiology Education. I work at Cincinnati Children's Hospital Medical Center. I would like to thank our senior editors for their contributions to this month's pediatric radiology blog, Dr. Paul Gillerman from Texas Children's Hospital in Houston, Texas, and Dr. Alex Tobin from Cincinnati Children's. We are so excited to share the current literature in pediatric radiology with you. Imaging characteristics of nephrogenic RES versus small Wilms tumors, a report from the Children's Oncology Group study AREN03B2. This is a retrospective study to distinguish the imaging characteristics of nephrogenic RES from small Wilms tumors on CT and MR. The characteristics included tumor size, shape, exophytic appearance, density, interface between the lesion and the adjacent kidney, and the location within the kidney. There are several overlapping imaging characteristics, but the study suggests that larger tumors, greater than 1.75 centimeters, that are exophytic and spherical in shape are more commonly Wilms tumors. The use of computed tomography versus clinical acumen in diagnosing appendicitis in children, a two-institution international study. This is a retrospective study that evaluates the differences in imaging use in children with suspected appendicitis between a children's hospital in the United States compared to one in Spain. The study describes that the center in Spain achieved an accuracy rate comparable to that of the U.S. center with much less reliance on imaging. In Spain, clinical acumen was most commonly used, and in the U.S., ultrasound was most commonly used. Value of multi-slice spiral computed tomography for diagnosis of tracheobronchial foreign body aspiration in children, 5-year retrospective study. This study evaluates the diagnostic value of computed tomography for tracheobronchial foreign body aspiration. Most commonly, the foreign bodies were vegetation items, such as peanut kernels and sunflower seeds, aspirated into the left mainstem bronchus. Chest CT has high sensitivity for detection of tracheobronchial foreign bodies, but its major disadvantages include ionizing radiation and its inability to remove the foreign body. The use of lung ultrasound compared to chest x-rays to diagnose pneumothorax following NUS procedure for pectus excavatum repair in children. This is a prospective observational study that compares the inter-reader agreement between chest radiograph readers and ultrasonography readers for pneumothorax detection after NUS procedures. The authors report that the overall agreement among the ultrasound readers was moderate and was only fair for the chest radiograph readers, concluding that ultrasound interpretation was superior. However, the major limitation was that the study design was not set up to truly compare the two modalities. This study only evaluated inter-reader agreement without a reference standard. Additionally, the study did not assess the clinical importance of detected pneumothoraces. Managing systemic venous occlusions in children. This is a review article on the management of venous occlusions in children. A brief background of systemic venous occlusive disease is included, along with the imaging workup most helpful in these clinical scenarios. The article primarily focuses on the endovascular management, including equipment, technique, and potential complications. Spinal ultrasound after failed landmark-based lumbar puncture, a single institutional experience. This was a single-center retrospective cohort study that determined whether or not pre-procedural ultrasound improved technical success and safety for ultrasound-guided lumbar punctures. Focused spinal ultrasounds after failed bedside LP attempt does aid in the technical success. It also augments patient selection for image-guided LPs by identifying procedural-related complications such as low CSF volume or presence of epidural hematomas. Clinical application of artificial intelligence-assisted diagnosis using anteroposterior pelvic radiographs in children with developmental dysplasia of the hip. This retrospective study developed a deep learning system to diagnose developmental dysplasia of the hip on pelvic radiographs. It also evaluated its clinical application by comparing its performance to that of pediatric orthopedic surgeons and pediatric radiologists. Image-guided percutaneous sclerotherapy of venous malformations of the head and neck, clinical and MR-based volumetric midterm outcome. This is a retrospective study that evaluates both the clinical and imaging outcomes of head and neck venous malformations after percutaneous sclerotherapy. The authors conclude that percutaneous sclerotherapy can be an effective therapy for head and neck venous malformations based on decreased size of the malformations and clinical improvement. Relief of symptoms did not necessarily require substantial volume reduction either. MRI findings of central nervous system involvement in children with hemophagocytic lymphohistiocytosis, correlation with clinical biochemical tests. This single-center retrospective study describes the MRI features of hemophagocytic lymphohistiocytosis, or HLH, in CNS involvement. These MRI features included normal findings, diffuse volume loss, and various brain parenchymal lesions. The MRI features correlated well with biochemical tests, which suggests that MRI may help determine the severity and clinical outcomes of HLH. Neuroimaging in pediatric mild traumatic brain injury, a systematic review. This is a systematic review that evaluates the relationship between advanced neuroimaging and post-concussive symptoms in children. A literature search of Medline, PsycInfo, Embase, and PubMed was performed. The authors conclude that the current literature provides insufficient evidence to draw meaningful conclusions due to differences in methodologies and relatively small sample sizes. Thank you so much for listening. For more details, please visit our blog where you can also find the links to the original publications. Feel free to share your thoughts and questions on the Pediatric Radiology Forum. See you next time.